Good morning. Today is Saturday, September 9th. So first, let's get some sound check. Check, check, check. Let me check it here in my device. Okay, check, check, check. Okay, check, check, check. Okay, very nice. Everything is working, and this is our Saturday morning regular yoga therapy class. As you know, it used to be in person for a long time, and the pandemic pushed us to virtual, and now it is being virtual because that is becoming the norm. But we are started doing in-person classes, in-person conferences, in-person presentation. This year, we are taking the requests, and our last request was, last week was yoga therapy for diabetes, and today's request is yoga therapy for thyroid diseases. Now, as like our other format, I'm first going to tell you a little bit of the patho-physiology, means pathology and physiology of the disease. Then you will understand the basic concepts, and based on the basic concepts, you are going to prepare your yoga therapy practices based on the philosophy, Yoga Sutra of Patanjali, and the 8-limb practice, Patanjali Ashtanga Yoga, and will give you the concepts from the Western medical standpoint and the yoga therapy standpoint. Thyroid gland is like a butterfly-shaped gland in front of your trachea, just below your Adam's apple. If you swallow, if you put your head little back and swallow, you can see this is the edges of the thyroid gland, and you will be able to see it, feel it. This is a very interesting story. The thyroid gland develops a nodule, like a small swelling, or we call a small tumor. And one of the TV personnel, guess what? She had the thyroid nodule, and one of the viewer pointed it to her, and she went to see the doctor, had a fine needle aspirate, the diagnosis was so and so, and she got completely cured. The thyroid disease is primarily a hypothyroidism. Less functioning of the thyroid gland is so common. When you get together in our social get-together, every other person is taking a levothyroxine, the thyroid supplement. Thyroid is an endocrine gland, and it also has another endocrine gland called a parathyroid gland. Thyroid gland secretes hormones, basically two hormones called T3 and a T4, and they maintain the body's metabolism. And thyroid gland function is maintained through a feedback cycle of the pituitary gland, which secretes another hormone called TSH, thyroid stimulating hormone, and the TSH controls the function of the thyroid gland. So when the function of the thyroid gland is low, the blood TSH level is high up, because pituitary gland is secreting more TSH to have a better function of the thyroid gland. And if the thyroid gland is producing more thyroid hormone, the TSH level will be low in the blood, because pituitary is telling thyroid, don't produce. And the thyroid hormones are primarily the iodine dependent. So lack of iodine will have a thyroid disease called a goiter, or the enlargement of the thyroid gland. And that's the reason you see all of our salt are iodized salt. That means you get an iodine through our salt. So the most common diagnosis of thyroid gland, as I said, is a hypothyroidism. That means low function. The other side of the spectrum is called a hyperthyroidism. That means overactive of the thyroid gland, which also called a Graves' disease. Since it is maintain our metabolism, when there is a more function of the thyroid gland, you will see increase in your heart rate, you will start losing your body weight, you will have a tremor in your hand, and it is so classic. And also there is called a thyroid eye disease, TEI, thyroid eye disease, which is a little bit of a we call it exophthalmos, looks like eyeball is sticking out a little bit. I remember a young fellow, he was studying, he was preparing his dissertation for PhD. He came to my home. I saw him, he said, I don't know, I'm eating everything, I'm doing all this stuff, I cannot sleep at night, I'm losing body weight, my heart rate is high, and I'm doing like this. I don't know what to do. Just took a glance at him. He was a typical classic picture of hyperthyroidism or Graves' disease. Had a doctor see him, and being a young age, he got a radioactive iodine as a therapy for hyperthyroidism. On the other side of the spectrum, when the thyroid gland is not producing much hormone, which is primarily, we call both the disease are called autoimmune disease. And we'll talk about a little bit of autoimmune disease, so we'll understand what kind of yoga therapy practices you need for a complete cure and correction of thyroid disorders. So other side of the spectrum will be, since you're losing weight, you start gaining weight. Since you're very hyperactive and you are lethargic. You don't feel good. You don't have any energy in your body. Your heart rate comes down. Sometimes your hair falls off. Many a time we have noticed a person having, my hair is falling off, and with all the investigation you find out that is a hypothyroidism. Treatment is very simple. You replace thyroid hormone, and the most common one in the market today is called a levothyroxine. It's generic, and they're all being prescribed. Thyroid gland also has a nodule called a thyroid nodule. You can feel there is a small lump. Some of them are benign nodule. That means it is not a cancerous. Some of them are hyperactive nodule. That means it is producing more thyroid hormone to create a hyperthyroidism, and most of the cases these are a cancer of the thyroid gland. Cancer of the thyroid glands are the cancers you want. He said, I want a cancer of the thyroid gland, because the survival for the cancer of thyroid gland is extremely high. Almost nobody dies from thyroid cancer unless it is called an anaplastic type. There are 4 types of thyroid cancer. One is called a papillary, follicular, medullary, and anaplastic. Most of them are called papillary. They diagnose called a fine needle aspirate. They put a small needle on the nodule itself because it's so easy, and then they take a little cells out, look under a microscope, and then the therapy is primarily a surgery. Surgery used to be through a small incision in front of the neck. Now a lot of our television or movie personalities doesn't want any scar. So the new young surgeons has devised a robotic thyroid surgery where they go a small incision in the armpit. They make a small incision in the armpit. They create a small called subcutaneous tunnel, and the tunnel comes towards your thyroid gland, and they use the light endoscope and they use the robotic surgery to do the thyroid surgery. Essentially, you end up with a no incision in front of the neck, you have an incision in the armpit, and it is being described as a no scar thyroid surgery. Now, before we start showing the practice, let's talk a little bit about autoimmune disease. So, in a Western standpoint, from Western medical standpoint, which is a reductionist. Reductionist means I have a thyroid problem, my whole eye, mind, everything is in the thyroid gland. But yoga therapy is holistic. That means you're looking at the overall, the human being, why it caused a thyroid problem, and you take care of it. Western medicine is so reductionist today that thyroid is an endocrine gland, and this is being taken care by a subspecialty called endocrinologist. Guess what? There are some endocrinologists today who only takes care of the thyroid gland. First of all, how many patients you have, you can guess, and then what is their protocol. Our immune system keeps us in balance. Immune system is our defense. So immune system can be low, called hypo, or immune system can be high, called hyper. When the immune system is low down, from the outside, we get an infection. We get the flu, we get this COVID-19, what we have. All the infections, everything which comes from outside is due to the low immune system. From inside the body, in a low immune system, we develop cancer. Cancer is an immunogenic disease. Now, many of you know there's a lot of cancers being treated with immune therapy now. Malignant melanoma, metastases. You might know our President Jimmy Carter had a metastasis to the liver and the brain. At the age of 96, he had immune therapy and is completely melted those metastases. He's 98 plus. He's in hospice care and he's still doing fine. So cancer is from the low immunity from within. When the immunity is high, from outside it causes your allergies. That means when you have been exposed to a pollen or a dust or any outside elements, body responds very high immune system. What happened again? Pictures are gone. Okay, here we are. Somebody's calling. Okay, so when the immune system is high, from outside you get the allergy, and from inside you get a called autoimmune disease. Autoimmune disease means your body is thinking that this organ doesn't belong to me, and they start producing the agents which are going to destroy that organ. You may have heard about so many, okay, that's another different topic. So from yoga therapy perspective, it is the balancing the immune system. So all the balancing practices, balancing asanas, balancing pranayamas, balancing meditation, whatever practices you are going to do, that will be the beginning. Also in yoga therapy is also a lifestyle. Also the yoga therapy is primarily the taming, means quieting down your limbic system, the emotional brain. Whole yoga therapy is based on your taming down the limbic system, hypothalamus, pituitary axis, reducing the level of cortisol and reducing the sympathetic tone. And I guarantee this will work for your thyroid gland also. From Western medical perspective, we right away give you all the thyroid medications. For hyperthyroid, we give a medication to reduce the thyroid hormone, and for hypothyroid, give medication to increase. From yoga therapy perspective, we are called integrative medicine. We'll give those medication, then we'll start a yogic lifestyle and yoga therapy practices. And in our experiences, you may not believe, but in our experiences, a lot of people are off thyroid supplement with yoga therapy practice. So conventionally in Western yoga thought process, you massage the thyroid gland. And that is also yoga therapy concept. Like when you massage an organ, it functions better. So think about it. Fish pose, Matsasana. If you do Matsasana, neck is going back, shoulder is all your expanded, and there is a massage of the thyroid gland. So Matsasana. Shoulder stand, plow, Sarvangasana, plow, Halasana. What else you can do? Ustrasana, camel pose. You go to the back, Ustrasana. So then you will be having your, what else you can think about? Bhujangasana, cobra pose. When you get up, when you put your neck to the back, Bhujangasana. Nokasana. Nokasana, you can do Nokasana. Even Balasana, when the child pose. Balasana, you go down, Balasana. From the pranayama perspective, it will first be Ujjayi pranayama. You can see when I'm doing it, It is massaging your thyroid gland. You know, when you have a coughing in Ujjayi Pranayama, that means you are really affecting the right place, because coughing comes from the larynx and Ujjayi Pranayama comes from the larynx. I'll show it to you a little bit more. Ujjayi Pranayama. Kapalbhati Pranayama. Because Kapalbhati Pranayama is your metabolic pranayama. It is called Agni Pradhan Pranayama. So if you understand these concepts, you will know what to use in your thyroid disorders. I don't have to tell you, because most of you are very, I'll say, advanced yoga practitioner with a lot of tools in your hand. So what you do, yoga therapy is the adaptation of the yoga practices based on the patient's clinical condition. So you already have the tools. You are just going to pick and choose. What else you can think about? We're talking about pranayama. Okay? Said Ujjayi Pranayam, Kapalbhati Pranayam, Mursha Pranayam. Mursha Pranayam, you take a deep breath in and slowly bring down your chin lock and hold your breath. I'm going to demonstrate all of them to you so you will see. Mursha Pranayam. And also the chin lock. When you do a Jalandhar Bandha, it's doing your thyroid. Nadi Shuddhi Pranayama, alternate nostril breathing, because it's the most balancing pranayama for your autoimmune disease. Think about what else. You know, I'm also not scripted. I'm telling you from my daily practice, you know, what we're doing. What you're talking about, Jalandhar Bandha. Jalandhar Bandha, Mursha Pranayam, Nadi Shuddhi Pranayam, Shankha Mudra. Shankha Mudra is a mudra which improves the function of the larynx, and also the Shankha Mudra is grab your thumb, put your hands together, and it will look like your conch shell. Shankha Mudra. Shankha Mudra. So, and also Tratak. Tratak is very good. So a person comes to you as a thyroid problem, and as you know, most of the people who we see, they are not motivated to start an asana practice. And asana practice also comes in time. So what do? We let them sit down in a chair, and we'll start with a little pranayama practice. And all of you know the basic pranayama practice is your basic pranayama practice is the lung. You have to empty the lung first, called exhalation, then slowly breathe in and breathe out longer than breathing in. Exhalation longer than inhalation. The first therapy for yoga therapy, Merudanda Achal and Manasthi. Merudanda Achal means spine straight. Sit down in a chair. I've showed you hundreds of times how to sit down in a chair with your spine straight. When you sit in a chair, your body will be like a right angle. If you have to begin, you can begin with your kneeling stool. Here is your kneeling stool. The moment you sit down in a kneeling stool with the knees here, your back is always going to be straight. In these days of the computer age, you need to have a kneeling stool and also have a motorized desk. So the desk comes up exactly, keyboards are here and looking straight into the monitor. Your spine is straight when you're working with your computer. Remember, these are the lifestyles which are part of the holistic yoga therapy. Doesn't matter whether you have a thyroid or the diabetes, we have a hypertension, all the gamuts will be relieved before you even know. Manasthir, mind. Mind in yoga is the content of your five senses. I hear, we see, I smell, taste and touch. Shabda, sparsha, roop, ras, gandha. So mind to quiet down, the first thing is close your eyes, because eye is the most important signals received to your mind, because eye is a direct extension of your brain. Brain is covered by the skull, eye is not. So eye basically is a brain. Close your eyes. Hand connects your body and mind. If I talk something, my hand moves before my tongue. And in my brain, the cortex, half of the brain, motor cortex, controls my hand. And half of the motor cortex controls the rest of my body. If I like something, I say this before I can say I like it. If I want something, I do this before I say I want it. So touching index finger and thumb, this is a mudra, called Dhanu mudra and Agana mudra. Putting this thing, close your eyes, keeping spine straight, breathing out first. Slowly take a breath in, effortlessly. Do not make any effort. And breathe out longer than breathing in. You can easily do count of 2 in, 1 and 2 in, and count of 4 out. 1 and 2 and a 3 and a 4 out. Muscles of respiration can be trained. They're skeletal muscles. We've been doing it for so long. We can easily do count of 4 seconds in, 8 seconds out, eventually 8 seconds in, 10, 16 seconds out, or 10 seconds in, 20 seconds out. It reduces your number of breathing and brings a profound relaxation. When you have a profound relaxation, slowly start constricting your larynx and try to do what is called resisted inhalation. You're trying to inhale against the resistance. Ujjayi means victorious. Initially you can do both inhalation and exhalation. You'll call it an ocean breath, call it Darth Vader breathing. So it will sound like to you, slowly constrict your larynx. Larynx is supplied by the two nerves, superior and inferior laryngeal nerve. Both are the branch of vagus nerve, and this is called a vagal activation. Vagal activation is your parasympathetic activation, calming and a relaxing response. Slowly and slowly, when you can get the Ujjayi pranayama a little bit more control for relaxation, then you can do a resistive inhalation in burst first, like this. If If you want, you can put your hand here on the thyroid gland, and if you do Ujjayi pranayama, you'll see that it's massaging your thyroid gland. And this is the way you start your yoga therapy practice. The person comes with a thyroid problem. You said, okay, let's get into the mat. Let's do a shoulder stand. Let's get a plow. This will massage your thyroid gland. The person will say, okay, thank you, bye-bye. Will never come back. Because they have never had exposure to yoga. And if you're practicing yogic lifestyle and yoga, probably you're not going to have a thyroid problem. So when you get a better and better in the Ujjayi pranayama, then you will do the Ujjayi pranayama, then you slowly bring a chin lock, Jalandhar Bandha. Because chin lock massages your thyroid gland and also massages your carotid sinuses. Then you incorporate a left nostril breathing, called your Chandravedi pranayama, parasympathetic left nostril. So all the thicker mind will be a profound relaxation response. And it should be the ideal therapy for thyroid disease. So, let me first show you what is a long Ujjayi pranayama will sound. Lung is a balloon. There's 6 liter capacity. We need 1.5 liter to keep it open. We have a 4.5 liter we can exchange called vital capacity, of which inspiratory reserve, that means the amount of air you can breathe in, almost 3 liters. Expiratory reserve, the amount of air you can exchange out, is almost 1.5 liter. And guess what? The amount of air you breathe in and out in one breath is only half a liter, 500 cc. And out of half a liter, 150 cc is from the nose to call it dead space. So only 350 cc of the air is being used. So breathe out first. Take a slow, long breath in. Completely breathe out. Again, you noticed I got a cough. That's what you were looking for. You get a cough, you did a perfect Ujjayi pranayama. Jalandhar Bandha, chin lock. Simple chin lock. Just normal breathing in and out. Exhalation longer than inhalation. Completely effortless. Remember, in a yoga therapy practice, you have no effort. Asana practice will be a pain-free asana, normal effortless breath. And normal effortless breath means you'll be able to talk, you'll be able to sing when you are doing an asana and a pranayama practice. So have your spine straight. Touch your index finger, thumb, put it on your knees, and slowly drop your chin down. So, and bring it down towards your chest. Able to stay here. And doing the normal effortless breathing, breathing out longer than breathing in. So these are the techniques you will be able to do sitting in a chair at the beginning. You don't need all these so-called name-brand asanas, which most of the yoga teachers are going to train you. So now, let's incorporate this chin lock with your Ujjayi pranayam, then your left nostril breathing in Shankha Mudra. So if you're a yoga practitioner, you can think about how powerful this yoga therapy is going to be. Shankha Mudra. Left thumb up, right hand wrapped around the left thumb, left hand wrapped around the right hand. Touch your index finger and thumb. Helping my larynx and the thyroid gland. Breathe out first. So what I'll be doing, I'll breathing out first. Take a deep breath in, breathe out. I'll be doing a Ujjayi pranayam, and halfway I'm going to bring your chin lock, and at the end I will do left nostril breathing. Can't be any therapy better than this for thyroid diseases. Breathe out first. Then you incorporate this with pumping and cupping. Keep rubbing your hands, keep rubbing your hands. When you feel the warmth in your hand, if you're wearing glasses, remove your glasses, take the hands like a cup, put it over your eyes, let the eyes take all the heat from your head. Relaxation of the eyes. Eyes is supplied by the 4 cranial nerves. SO4, LR6, muscle superior oblique supplied by 4th cranial nerve. LR6, lateral rectus muscle supplied by the 6th cranial nerve. Retina is supplied by the optic nerve, 2nd cranial nerve, and outside is supplied by the trigeminal nerve, 5th cranial nerve. Take that, and also relaxes your ciliary muscles, controls curvature of your legs. When you massage your forehead, all the muscles attached to the skin in the face, they get relaxed. So all the lines, all the furrows, everything goes away. Your skin, people will look at you and say, look at your skin, look how good it is. The skin health comes from inside, called cutaneous vasodilation. Blood vessels open under the skin and the skin better. Bring the hand, massage your earlobe, behind your ear, in front of your ear, inside your ear canal. It's an auricular branch of vagus nerve. It's a vagus nerve stimulation. Bring your hand, massage the both sides of your carotid sinuses. Carotid sinuses relaxes your, controls your cardiovascular system, nervous system. Take the hand and massage your occipital tubercle, where the 2 muscles, sternomastoid muscle, trapezius muscle is inserted, supplied with the cranial nerve. Murcha pranayam. Murcha means you're almost unconscious. It is your breath holding in inhalation. retention. We also call it Abhyantarin Kumbhak with chin lock or Jalandhar Bandhan. So when you breathe out first, take a deep breath in and hold your breath. All the air get exchanged from your blood to the lung and the air cannot come out, so the lung starts to expand. The lung starts to expand, it comes to at the end, the rib cages, and it goes any further. So it starts a reflex called a herring-brewer reflex, which is mediated through your vagus nerve, and the lung starts to compress back, activation of the vagus nerve, coming and cooling. Inhalation is called Purak, breath holding is called Kumbhak, breath holding and inhalation called Abhyantarin Kumbhak. Exhalation is called Rechak, and breath holding and exhalation, which in English called suspension, is called a Bajra Kumbhak. Let's do the Murcha Pranayama. Again, touching the index finger and thumb, quiets down your pitta, it's your Jnana Mudra or Dhyana Mudra. So breathe out first. Slow, long, deep breath in. Hold your breath. Slowly drop your chin down, touch the chin to the chest. Your breath is on hold, and you keep counting 1 and a 2 and a 3. Say how long you can hold your breath with the chin lock. With a good regular practice, you can hold the breath for 40-45 seconds, and sometimes you can go almost to a minute. Breath holding and exhalation is a lot shorter. That's about half the time, about 20 seconds. So this is your Murcha Pranayama. Murcha is so calming, cooling, because you have a breath holding and inhalation, which is a vagal activation, and the chin lock, which is the activation of your carotid sinuses and massaging your thyroid gland. Wow, I'm already feeling the effect of it. I'm developing saliva in my mouth. I've been talking for so long, still have saliva parasympathetic activation. Nadi Shuddhi Pranayama, alternate nostril breathing with the breath holding. So use a mudra, Vishnu mudra, bring your index finger and middle finger down, like a pinch with the thumb, little finger and ring finger. You'll be putting over your nostril, you will be doing breathing out first, breathe in, and also see I all this practice with my eyes closed. It becomes spontaneous and evenful for me, because when I'm practicing on my own. I mean, practicing for introspection. The hand mudras are very important. So breathe out first. You breathe in a ratio of 1:4:2. Like a breathe in for a count of 4 in. Then hold your breath for a count of 16, 4 times. Then breathe out with a count of 8, 2, ratio 1:4:2. And slowly, if you can increase it the same way, you get a breathe in for a count of 5, hold for a count of 20, breathe out count of 10. Let's show the count of 4. Again, touch your index finger and thumb. This is your Hasta Mudra and gesture. We start from the left nostril, close your right nostril with your thumb, breathe out through your left nostril, and then breathe in with a count of 4 in. Hold your breath for a count of 16. Breathe out through the right nostril with a count of 8 out. Now do from right side. I'll increase one more number. I'll do a 5-second in, 20-second hold, and 10 seconds out. Breathe out from your right nostril. Nadi Shuddhi Pranayama, excellent for balancing. It balances both sides of your brain. Left nostril is controlled by the right brain. Right brain is intuitive. Right brain is female. Right brain is cooling. Right brain is parasympathetic. Right nostril is controlled by the left brain, which is analytical, which is male, which is heating, which is sympathetic. Balancing pranayama, same as a alternate nostril breathing. The Kapalbhati pranayama, as I said, is your metabolic pranayam, Agni Pradhan pranayam. When we have all seen, we do with all different mudras, 10 mudras, and there is a balloon here, there's a diaphragm here, the balloon here. We push the balloon in, hits the diaphragm, hits the lung, all the air comes out. Massages all the internal organs, massages your diaphragm, massages your lung, hearts. It's called Agni Pradhan Pranayam. It ignites your Jathar Agni, digestive fire. You've seen it, but simply just show you how we do it. And you can go to my pranayama section and look into it. Nothing moves, only this belly button goes inside and air comes out. So your body is straight, spine is straight, your attention is in the belly button. Sometimes somebody told me, I cannot do it. Cannot do it? It's okay. Can you cough? Yes, I can cough. Show me how you cough. Can you cough with your mouth closed? It became Kapalbhati pranayama. Okay, let me show you a few asana practices. And as you know, in a standard yoga therapy practice called 8 limbs of yoga, it's a yam, niyam, asana, pranayam, pratyahara, dharana, and samadhi. So asana comes before your pranayama, then the pratyahara is very important, and the focus, and 7th limb is the meditation. Meditation comes to you when you prepare your body and breath. Meditation will come to you. But most important thing what you need to do is your preparing your body and breath. So let me see if you, this may be too high for Matsasana. People who are just starting your Matsasana, okay? You can take a couple of nice pillows. I can get some pillows, or I have this, okay, let me see. We always improvise things. It may be too much more than a couple of pillows, but what the yogis can do. Matsasana, your fish pose. You know how to do a Matsasana, get down, but people who are starting. So if you can open your chest and drop your head down. So slowly put your chest here and drop your head down. Separate your head. Let me see. I'm feeling great. You can see the massage and stretching of the thyroid gland. You have to have your breathing completely effortless breathing. And Matsasana without any support, it will be same thing. So your chest will go high up, your head will drop down, and you'll be able to feel the profound stretching of your another very nice technique. Have you seen a yogic sit-ups? If you want to do with me, try doing with me. It's wonderful. So, in a regular sit-ups, you lay down. These are also affect this part. So you get up, touch your sit-ups. Yogic sit-ups. Put your hand behind your head. Oh my God, it's almost impossible to get up. Try this. Almost next to impossible initially, but just switching your hand behind your head. makes a difference. So I'm still talking, I'm still singing, so I'm effortless. Ideal asana for thyroid. You have to be yogi to do this kind of practices. That's how we started your pranayama practice. Meditation will come to you. We call it a breath-centered meditation. Sarvanga-asana. You can do a lot of things Sarvanga-asana. You could do a Gururasana on a Sarvanga-asana. Eagle pose on a Sarvanga-asana. You can do even a lotus on a Sarvanga-asana, or you can go from here, you can do halasana, plow. See, in a plow, you are breathing, you are talking. That's what you want to do. A lot of even advanced yoga teacher asked me, how do you practice this? How do you teach this? This increases this increases this. This will, oh my God, this will kill you. No. Follow your breath. You know, practice halasana. Practice with the breath. Come here. Be sure your breath is effortless. And if you can come a little bit longer, be sure your breath is effortless. You can talk. Come here. Breath is effortless. Is in stages. Impossible to be possible. You are not going to get here in a first day of your practice. So what else? Think about here. What is going to affect you? Cat pose, Marjanasana, Ustrasana, camel pose, Bhujangasana, Dhanurasana. Can you come up with any more asanas which is going to affect here? Did somebody put some, yeah, I can look at it. Did somebody put some name asanas here which will affect thyroid gland? Yeah, we have a lot of advanced yoga teachers are here. I can see their names. Okay. Ustrasana. Generally, when you're in the four, what you do, this is just a simple rule of thumb. Take your hand, be sure your knees are separated in the arm's length and your hands are also in the arm's length. This gives you a nice stable top. You can drop your navel. You look slowly, look high up. Breathe out, slowly get into the cat pose, Vajrasana, and stay in the pose with your breathing out normal, then breathing in, then 5 to 10 breaths. Touch your ankle, push your body in the front, and drop your head down. camel pose, Ustrasana. Bhujangasana, Dhanurasana, Cobra pose in C. Bow pose, Dhanurasana. Nokasana. Nokasana is very important because in a Nokasana you will see that you get your fasciculation initially and the fasciculation will go away. So did anybody put any asana here? I'm just looking at it. No, I don't see. Anybody who's watching, can you put any other asanas which is effective for your thyroid disorders? In a boat pose, Nokasana, what you do, you're laying down first. They're very important. Once you have these concepts, so easy to practice. So if you raise your feet high up and slowly get your body high up, initially you'll see your body is doing like this, but slowly and slowly you'll get into a boat pose and sthiti. Sthiti will come in. So yoga therapy believes that staying in a pose little longer and longer time within your means no pain and effortless breathing. What does it mean by effortless breathing is in yoga, the heart and lung is the same organ. If you put your body, physical body in stress, your heart gets into the stress. If your heart gets into stress, your breathing gets into stress. That means you have an effort in breathing. If you get effort in breathing, you are harming yourself than healing. Remember, huffing, puffing, hypoxia, running, pushing yourself to the max is very good for your strength, stamina, building muscles, doing all this stuff. But for healing, it's a relaxation response. It's parasympathetic activation. It is as good as it will be a nice healing playing with your grandkids. One of my very famous cardiologists who knows about yoga therapy told me playing with your grandkids is nothing but parasympathetic activation. Meditation, you don't have to push yourself. I have so many yoga teachers said, oh, I'm not so interested about this physical asana practice. I go to meditation right away. Within 5 minutes I'm in meditation. See, meditation is not that you're able to sit down, close your eyes and pay attention to your breath. Meditation is quieting down your mind. And if your physical body is not ready, the physical body is going to wake you up. Sthiram Sukham Asanam. Stillness, happiness in an asana pose. Pranayama, completely effortless pranayama. You come back to your meditative practice. Alternate nostril breathing without closing your nostril. Paying attention to your breath. Visual imagery. These are all fantastic meditation practices. But for the thyroid, what we showed you as the most meditative pranayama practice. Ujjayi pranayam, chin lock, Jalandhar Bandha, left nostril breathing, Chandrabhedi pranayam. Let's finish our practice with one of these practices. Again, sitting down, getting up without any support, or you know what I mean. I want to show it to you. Sign of health. Sit, rise, test. Sitting all the way to the ground. Oh my God, I cannot get up. Easily you get up without a support. Use your one hand. You lose your 25% of your health. Use two hands. Use 50% of your health. So, two hands and a foot, lose 75% of your health. So last practice for your thyroid disease, and with more closure, so you'll be able to see better. Dhyana mudra, Rekyana mudra, over your knees. I tell you the sequence again so understand. So I won't talk, I'll just show the practice. Breathe out first, long breathing out. Maybe count of 10, 15, 20. Long breath in. The count of 10, 12. Breathing out. Slowly constrict your larynx and breathe in against resistance. Halfway through that, you bring the chin lock, putting your chin down, and at the end, you breathe out through your left nostril. Chandrabhedi pranayama. I'll show you one time and look at carefully how to do this. Thyroid gland said, I don't want to create any trouble in this body anymore. Did you notice? Every time I did a Ujjayi pranayama, I got a cough. What does it tell you? I've been doing it for a long time. And it's hard initially to get in, but slowly and slowly they say. In stages, impossible become possible. And with the daily practice, everything comes to you instead of you are looking for a practice. Thank you again. please let me know if you have any other request. I just got a request for I think knee problem and arthritis, and I just already have it this year, yoga therapy for knee health. So you can go ahead and take a look at it, and probably will repeat it the next year again. So if you don't have one request, I will pick it up, another dis-ease, and will come to you. Thank you for joining. See you next Saturday. Let me see, next Saturday. Oh, next Saturday I'm going to be out of town for a program, so I may not be here next Saturday. But we'll let you know through your Facebook posting.